Well, you specifically asked about Medicare. So
Yes.
I think there are a couple different ways, and there are different approaches out there to do that. One of them is the suggested plan that Mr. Bruno referred to, Paul Ryan's plan, that has a voucher or a premium that's given to Medicare recipients. And his newest plan has both the choice of either a voucher plan where you're given X amount of dollars from the government to go out and purchase your own health care, or you can stick with the Medicare plan the way it is today. So you have those two options in the Ryan-Wyden plan, which I think that's one way of looking at Medicare. The thing is, we have to do something about it in order to keep it available for future generations and to make sure that we aren't spending ourselves into debt. So there's no question that Medicare has to be reformed. I think, I've taken the position that we've got to protect people who are on it today and who are getting close to being on it, whatever age that might be, 50, 45, actuarially how that works out. But I think there's also some other things that you can look at in Medicare if you aren't going to take the route that Paul Ryan's going, where you make some adjustments to Medicare as we know it today. For example, raising the eligibility age, that saves about 30.5 billion, excuse me, I'm still in the millions, sorry, the $1 billion a year, and that would be raising it by about 2.5 years. You can do means testing. Again, that saves approximately $100 billion a year. Tort reform is another option, $23.3 billion a year. And then if you make drug companies pay their rebate back to the government, you can get up to $51.5 billion a year. So those are some specific things that could be done right now to help save the Medicare program today. And I think that's where we need to be looking at those kind of different options and see what works best. I think the preferable way to do it is where you do have the choice between a voucher plan and some of these other adjustments that can be made to the existing program, and people can choose. Now, I have one caveat on that, and that is to make sure that that voucher plan can keep up with the cost of health care, because that is a difficult population to insure. It's an aging population, and as you know, that makes it more complicated because as people get older, they get sicker, and so then it costs more. And there needs to be some assurance that that voucher plan can keep up with the cost of health care for those people who have no other means of paying for it.